go. So today we are going to go over some invoicing updates. I'm going to walk through annual monitoring by the Bureau of Housing Supports, which we refer to as recipient housing. We're also going to examine annual performance reports that are due to us and HUD. And we will be looking at the FY 2023 NOFO debrief in relation to all of the COC projects. And then we'll do a review of performance monitoring, which is done by the collaborative applicant for the balance of state. This is going to be a lot of information, but I'm really trying to hopefully educate all of you on how all of this ties together and what information is out there for your projects to review and how it impacts your projects, how it impacts the continuum of care, and how it impacts our NOFO scores. So we're going to start with YHDP, SNOFO, and continuum of care invoicing. Invoicing is not just as easy as submitting an invoice each month to the Bureau. We had an audit back in 2018, and we had to revise all of our policies and procedures to include required backup documentation that has to be submitted with the monthly invoice. The invoice and the backup documentation are part of the larger picture required of all COC projects in terms of ensuring that all projects are meeting HUD's requirements, the Bureau of Homeless Services policies and procedures, and that we're adhering to the continuum of care interim rule. So each month, each subrecipient agency submits to BHS the request for reimbursement based on your budgets attached to your contracts using our standardized invoice form. I am not on the right slide. That would be helpful. Invoices are due by the 15th of the following month. So any reimbursement for expenses that were incurred in January have to be received by the Bureau of Homeless Services by February 15th. Any invoices received after the 15th of the month may not be processed till the next month. Invoices are all submitted to our general inbox, which the email address is up there for everyone. We do have several different BHS staff assigned to your different grants, depending on who you have. All COC invoices right now are being mainly processed by Greg Pratt, who is part of the Bureau of Homeless Services team. Heidi Young reviews all of the YHTP invoices, and then Mandy Reagan and Rob Waters do the 2 SNOFO process reviews. Once an invoice is submitted, our staff reviews it to make sure that you're submitting an invoice for eligible costs, that those costs were approved and they're within your budget. If there's no issues or problems with the invoice and the backup documentation, we submit it to our financial team. And then we are required, once the final approval is done, to pay agencies back within 45 days. There may be certain times that we have questions about your eligible expenses or something on the invoice, or the math just isn't lining up. So you may have BHA staff reach back out to you to get further information or documentation in order to make sure that the invoice is correct for what you're submitting for. So along with the invoice, we also request that you submit, if you have a supportive services budget, your supportive services master spreadsheet. We are looking for your people to submit any new rental calculations or changes in rental calculations. We ask that you do this so that we can do a spot review to ensure that rental calculations for participants are being done correctly. For those of you who have leasing or rental assistance project, we look for that backup rental worksheet. And we're also looking for you to include either in the email or through the rental worksheet how many beds and units you are utilizing for that project at a specific time. Unless you have a specific corrective action plan between the Bureau, you are expected to maintain all of your source documentation and make this documentation available to BHS and HUD upon request. We may request more documentation during scheduled or unscheduled desk audits and when we do our annual monitorings. It's just a brief overview. Next, we're going to move on to annual performance reports, as we all call them, APRs, and we're going to do a brief overview of what an annual performance is. We're going to look at how the APR ties into other HUD reporting efforts, including system performance measures, the continuum of care notice of funding opportunity, the NOFO, annual monitoring, and performance monitoring. We're also going to review some of the APR questions that really impact a project's performance and tie into the three things I just said: system performance measuring and monitoring and NOFO. So what is an APR? An APR is a report that is generated either from HMIS or your comparable database. The report is designed to provide an overview of how your project performed over the course of the year. And this report is really outcome focused. An APR can be run at any time throughout a grant term in order to review your data and look at how to improve outcomes and ensure that the project is meeting its requirements that were set forth in the project application that was submitted to HUD. These reports can really help you look at your project's performance, and it helps us measure project performance as well and what we need to look at moving forward in the next year to improve a project's performance. APRs are due to the Bureau of Homeless Services 30 days after the close of your grant term. And then we are required to submit that report back to HUD within 90 days. Typically, we will enter all of the information, review the APR, and then send you any follow-up questions to ensure that we have the information accurate, specifically looking at if there's any data quality issues or if we have other questions that come out of the annual performance report. We do utilize annual performance reports in the NOFO scoring process, which we do every year. The APR was recently updated, and we are working on further guidance in the next couple of months because there were some new questions added to the APR. So your APRs can provide information on number and characteristics of people served, the services that were provided, your project outcomes, including where people exited to, your income sources, cost effectiveness of your programs, and the cost for the full program. So it really looks at, you can see like number and percentage of people who moved into permanent housing, the number and percentage of those who increased income. So I'm just going to briefly review some of the key terms in the APRs. The first one, of course, is chronically homeless. And as most of you know, this is an individual or household who's been homeless for at least 1 year or who has had at least 4 separate occasions of homelessness within the last 3 years, where the occasions add up to 12 or more months. A leaver is a person who exits the program and is not active on the last day of the operating year. A stayer is a person who's enrolled in the program on the last day of the operating year. I'm not going to review this in depth, but here is just kind of a breakdown of some of the subpopulations that you will see in the APR. Next, I'm going to go through some of the questions that are very pertinent to all of your projects. And this is just kind of a really brief overview of an APR. There's all sorts of other information within APRs that can be useful for projects. So question Q2 on your APR is your bed and unit inventory and utilization, or as most people call it, people and households. It shows information for how many people and households were in the project for the grant months of January, April, July, and October. This information can help projects ensure that they're serving the number of people that they stated in their project application throughout the year. Q5, this table provides information on the number of people served, broken down by subpopulations, including adults, children, veterans, those experiencing chronic homelessness. Q6 is your data quality in HMIS or your comparable database. This provides information on the quality of your data entered into HMIS, including universal data elements. Q7 and 8 both provide information on the number of households and the people served throughout the year. And then these are the ones that really we look at throughout the year for COC projects specifically and throughout the NOVO project. Q15 is your living situation. This is where the participant was residing prior to entering into the project. Participants should be entering the project from a homeless situation, either category 1 or 4 of the homeless definition, if this is a housing project. There may be times where you'll see that participants enter the project to join an already existing household, which may lead to other entries in the living situation categories, such as they came in from staying temporary with friends and family, and they moved into a COC project household. We have to make sure that that household met the homeless criteria prior to entering the project. Q19, these questions show client cash income, including changes in earned income and other income. Again, this question is part of NOFO scoring and performance monitoring scoring, which we will discuss later. Q20 shows the type and number of non-cash benefit sources, or as we call them, mainstream resources. These questions are also part of NOFO scoring and performance monitoring scoring. Q22, this is the length of participation in a COC project. This question has several, it's like 22A through F. And it looks at the length of time someone has been in the project, including the average and median length of time. This question is particularly important for RRH projects to review. As with COC projects, we can only provide rental assistance for up to 24 months. And for YHCP projects, if you're approved for this special activity, you can assist up to 36 months. So we really want to look at this to make sure that people are not staying in the project longer than is allowed. And then question 22F really looks at the length of time between the project start date and the housing date. These are two different fields in HMIS that have to be filled out. HUD is really looking at us to expedite placements into permanent housing as fast as possible. And I know we all know this, we're in a housing shortage crunch, but they still are looking at these numbers. And then last but not least is my favorite APR question. I never thought I'd say that about a data report, but Q23 shows exit destinations. This is where people are exiting the program and where they are going. HUD is really looking at making sure that we're ensuring exits to permanent housing from the COC projects. They do not want to see exits to temporary situations or return to homelessness if most possible ever. But it really looks at what are your outcomes of your project and are people exiting to permanent housing situations and able to maintain that. So since I just did a brief overview of the APR, we're going to kind of switch gears a little bit and talk about the FY 2023 NOFO debrief, which we just got back from HUD, and talk about some of those questions. The first one is we are scored on housing first and lowering barriers to entry. This really means allowing program participants, regardless of their income, their current or past substance abuse, history of victimization, and criminal records, are allowed into our projects, unless there are restrictions imposed by federal, state, or local law or ordinance. We have to demonstrate that 75% of all of our projects meet the housing first approach during the NOFO process. We have to, during the NOFO, describe what tools and methods are used outside of our local competition to regularly evaluate all of our projects on using a housing first approach in their project and in project implementation. Currently, our Bureau is using HUD's Housing First tool, and we will be asking all the subrecipient agencies to complete this tool in the next couple of months, which will be reviewed by the Continuum of Care. We will be offering technical assistance and support to any agency that needs it. We also are working on a Housing First series that will occur over the next year and will be available to all of the projects within the Continuum of Care and the providers. We're very excited about that. There will be about one training a month, except for like the summer months because of NOFO. So we'll be sending that information out hopefully very, very soon about that training series. We did, as a Continuum of Care, we received 9 out of 10 points out of this question. And I can tell you that all of our projects are housing first. HUD does not give us clarification on why we didn't receive full points. We kind of talked about this one a little bit, but we have to, as a Continuum of Care, evaluate every project for housing first. And we do that through using the Housing First tool. And thankfully, our Continuum of Care received 3 out of 3 points during last year's NOFO. So we're hoping to continue to receive full points on this question to make sure that we're really using a housing first approach for all of our agencies. So we're going to talk a little bit about system performance measures and what they are. System performance measures are submitted by our Continuum of Care every single year. They're part of the scoring process for NOFO. System performance measures include information on length of time homeless, retention in permanent housing, and increases in income, reducing recidivism, and reducing returns to homelessness. Specifically for all of you, we are specifically looking at measure 4 and looking at jobs and income growth. Really looking at increasing a program participant's income through either employment or non-employment cash sources. During the FY 2023 NOFO, we had to demonstrate that between the 2021 NOFO and the 2022 NOFO that we increased the number of COC participants who had increases from income from employment. And they were looking for it to be 20% higher between those 2 years. They were also looking for a 50% increase for program participants between those 2 years and increases to non-employment cash resources. As I said, HUD really looks at our system performance measures during the NOFO. They're looking at changes for both the leavers and the stayers in the project for the reporting period. Really looking at those changes in employment income, as I just said, non-employment income, and total change in cash income. During the NOFO, we have to describe our strategy to access and assess employment cash sources, how we're working with mainstream resources and employment organizations. And we also have to describe our strategy to access non-employment cash income as well. So just kind of for clarity's sake, we look at the employment and income growth and the increased connections to mainstream benefits through your annual performance reports, through the NOFO process, and through system performance measures. So this is a really important one that we're really looking at. And HUD had a very specific focus last year on connections to employment. So we kind of already talked about this, but HUD is pushing for increases to incomes and making sure that we're offering those resources to program participants in any of the grants. and doing what we can to connect them to either non-cash or employment if that's an option for that household. Nope. So of course, I had to include this. There is your data that you put into your HMIS and you can review through running an annual performance report really impacts our system performance measures. If there's missing or unknown data, it reduces the accuracy of our system level data. And again, as I said earlier, there is question 6 on the APR that really looks at your data quality and breaks it down for you so you can make any corrections in HMIS. So again, we've kind of talked about this, but we're really looking at leveraging changes in clients' incomes for the system performance measures, for your annual monitoring reports, and for NOFO. And that information, again, is captured in the question 19 on your APR and also questions 20. It's really important that we're collecting all the data, specifically income and connections to benefits, at your project start date, their exit date, their annual assessment date, and providing those interim updates in HMIS. So really, we all know the purpose of COC projects in YHTP and SNOFO is hopefully to ensure that households are able to obtain, maintain, and sustain permanent housing. Again, HUD looks at, as part of the system performance measures, exits to permanent housing. And they're really looking to that we are ensuring that households do not return to homelessness within 6 to 12 months, which is one of the other system performance measures. We also review exits to permanent housing during the NOFO scoring process as well. So what can we do about this? Your agencies can run annual performance reports at any time from HMIS or your comparable database. And all of the COC projects, Bureau of Housing Supports as a recipient of the grant, and the Balance of State Continuum of Care need to be reviewing APR data and really identify those projects that need assistance with any of their data, their system performance measures. And again, we do annually monitor each COC's project performance. Oh, hold on, I'm jumping ahead on my screen. And as we talked about already, during the NOFO process, we have to rate and rank every single one of the renewal and new projects. We have to ensure that it's objective and a transparent assessment of both existing and new COC projects that are funding. And HUD uses all of our data from the system performance measures to evaluate our COC as a whole. And it provides information for scoring. And the better we score, the more likely it is that we're going to get new projects for our continuum of care in order to be able to support those who are experiencing homelessness. So when we do actually rate and rank projects for the NOFO process, we use that APR. We use the APR from the previous calendar year to look at certain data key points to be able to rate and rank all of the projects. HUD provides us with standard metrics to evaluate projects, and they have told us 20% of your questions need to be objective and pull down this information. And you'll get 2 out of 9 points if you do that process. 33% of your questions have to be directly related to system performance measures. So that information really comes from HMIS and your comparable database. So we're going to briefly take a look at the 2023 scoring tool. Let me just switch my screens. Hang on a hot second. it up. And while I do that, does anyone have any questions? Hang on one second. So this is last year's renewal project application scoring tool that is used with all of the renewal projects. And we do have different tools for new projects and for coordinated entry projects as well. This one is really for housing projects. And what we look at is we go through the first 6 questions, which really are our threshold questions that are set forward by HUD. We're looking to make sure that your project type is serving an eligible population. Because as of right now, none of our projects within our continuum of care can serve category 3 of the homeless definition. We're looking to make sure that eligible costs are including your project, that the agency is an eligible entity, you have 30% match or more, your projects will participate in coordinated entry, and that they meet all program eligibility requirements. If any of the answers in 1 through 6 are a no, this project does not meet threshold. This typically does not happen with renewal projects. It may happen with any new project applications that are submitted. The next question is really, what type of project are we looking at? And then question 8 is looking at the number of new households experiencing chronic homelessness. And for those projects that are dedicated to DV survivors, we're looking at the percentage of new households experiencing literal homelessness. Questions 9 through 16 are really looking at project utilization. Looking at, are you serving the number of people you propose to serve? Looking at housing stability. So again, earlier I talked about, we look at your APR for those exits to permanent housing, or if they remained in permanent housing. So again, that question comes right from your APR and your HMIS data. We also look at the percentage of people who left permanent housing to their own housing unit, where they can stay permanently. We also look at, for DV projects, we look at the safety of survivors and if that has improved for them because of entering into this project. Questions 12 through 14, this is what I was just talking about in regards to system performance measures. This is measure 4. Again, HUD looks at, are we increasing income, employment income, non-cash benefits, and any other sort of non-employment cash related income. So we really look at that and try to hone in on it in the scoring tool. And then question 15 really looks at all of the people who exited to shelter, streets, or unknown. Again, that's part of your system performance measures. We're looking to make sure that people are not returning to homelessness and that they're exiting to permanent housing. Question 16 is really looking at, we're ensuring, hopefully through the coordinated entry system, that we are serving people who are the most vulnerable. I know that your projects do not have any control over this because of the coordinated entry referrals, but I will tell you 9 out of 10 times, most of the people who are getting referred to your project are most likely experiencing chronic homelessness, so they have a disability, and most of them usually do not have income or they have very little income. Questions 17 through 22 really look at financials for your projects in HMIS. How much of your grant did you spend down last year? How much was spent per household? HUD is starting to focus on the cost effectiveness of projects. Questions 19 and 20, again, those are your data quality questions. That is Q6 on your annual performance report. We are looking to make sure that data is entered accurately and correctly. You're not missing anything for any of those universal data elements that we are required to collect. And we're also ensuring that you're entering data in a timely fashion, because within the balance of state, you have to enter your data into HMIS within 5 days. The next two are ensuring that we're submitting those APRs in a timely fashion, and also that you're attending our meetings. So I know every single time we get into a meeting, I ask everybody to put their name and agency in the chat box, because we record your attendance at meetings throughout the year, which is part of your NOFO scoring projects. So if you're attending these subrecipient meetings or you're attending the balance of state meetings, we use that attendance to make for this scoring purpose. Questions 23 through 29 are the equity factors, which were added a couple of years ago. In our next meeting, we're going to really focus in on what was presented during the 2023 NOFO in regards to equity. And we'll talk more about that next time we all get together. And then lastly, as I talked about earlier today, housing first. We make sure that every single project coming in and is renewing is a housing first project. Hence, we do those housing first assessments throughout the year as well. Anyone have any questions? I will pause there for a minute.
Hey, Christy, this is Gary from Community Action.
Hi.
Howdy, howdy. So with our program, we have a Southern New Hampshire Services program where we do our primary case management. And if they meet the definitions of homelessness, then we put them into coordinated entry.
Correct.
In a lot of cases, the folks that come through initially, we aren't able to gather all of their demographic information within the Southern New Hampshire Services program. Does that affect the NOFO scoring?
So coordinated entry projects are a little special right now. A couple of years ago, probably like 1 or 2 years after I started this job, we do not have to score coordinated entry projects for the NOFO project, and we include all of the coordinated entry. So the one that all of the CAPs have, and the new ones through YHDP and the coordinated entry DV project, they do not have to be scored. But I would say on the other hand, if you can't gather all of the data and they move into a permanent housing program, the permanent housing program can update that information in their system.
Okay,
Does
perfect.
And
I just wanted to make sure, because, you know, I'm still relatively new to this, and I just want to make sure that we're following the guidelines of what we need to do in the space that we're able to do it, because there are some folks that I'll have a single conversation with, give them resources, and then they never come back. And so I don't get to ask, you know, identities and disabilities and the like.
Yes, and we are working on a way for all of you coordinated entry projects to capture that data, and what data you can gather sometimes for those people who only show up once. So there'll be more to come on that in the next month. We are working with, Mandy and I are working with ICA on that, because we've had a rapid increase in coordinated entry and supportive services projects over the last couple of years. So we're putting that all together.
Perfect. Thank you.
You're welcome. Anybody else? All right, let me get back to sharing my screen. All right. So I talk about data, and I am not a data person, but I'm becoming one. What can you do about this? You can do monthly APRs on your projects. You can do quarterly APRs on your project. The Bureau of Homeless Services has started including information about system performance measures in your monitoring reports when they go out after we audit you once a year. Really making sure that you're looking at your data and catching and correcting any data issues early on. And sharing that information with your key stakeholder people, whether it's project staff and leadership, the HMIS teams, and just really making sure you're taking that time to review your data, not just when we do the APR, but throughout the year. The next big one. So coming soon, the Bureau of Homeless Services, as the recipient of the grant, is required to monitor all projects annually. That monitoring is different from performance monitoring because that one is typically we come and visit you, we review your financials, your participant files, and we really look at making sure that you're meeting the requirements under the continuum of care interim rule. The balance of state continuum of care is required to monitor each project as well once a year on their performance. We really look at making sure that our projects that we have within our communities are high performing projects, and providing technical assistance and support to those projects that are low performing. So you're probably all wondering why I talk about that. And for some of you who've been here for a couple of years, we typically do the performance monitoring in March. So we work together with the executive committee to put those reports together, to really look at how our projects are performing, and we send out that information to all of you. This is also in our New Hampshire 500 reallocation policy. We are looking at, for performance monitoring, again, we pull that information that's in your APRs and through the NOFO scoring. We're really looking at performance measures, your percentage of your grant spent down, and your HMIS data quality. So I'm hoping you can all see there's a theme throughout all of these reporting things. They're all tied together. We're really looking at your data quality. Are we increasing income, non-cash, or employment? Are you connecting people to mainstream resources? Do you have good data quality? And that goes across all of the fields, whether it's when you do your annual performance report, we are looking at those things. HUD looks at it through the system performance measures. And then the balance of state continuum of care looks at it when we do performance monitoring as well. Hold on. So we went quickly through the project renewal scoring tool just a few minutes ago, but again, we're really looking at, for the projects during NOFO, is those rapid exits to homelessness, exits to permanent housing, increasing income and non-cash income, and increasing connections to mainstream benefits. BHS will be sending out more information about reviewing your APR in the next couple of months. There was an update recently, and there have been some new elements and questions added to the annual performance report. But we are working on a tool so that you can review your own APRs and know what you're looking at. So I know we've talked a lot today about reporting, data, all of those things. And we also talked about NOFO scoring, performance monitoring, and all of those things. The reason we talk about this, again, is because HUD is looking at us as a COC and a recipient agency to monitor our projects. We have a reallocation policy and procedure within the balance of state. Because we really want to make sure that if we have low performing projects, that they're offered technical support or assistance, or if they continue to not perform well, we look at reallocating that project and their funding. There's two different types of reallocation within the balance of state, which I'll go into more detail in a few minutes. So we have set up the voluntary reallocation project. This is where either recipients or subrecipient agencies are able to voluntarily reallocate their COC funding. And that funding goes back into the pot, as I call it, to create new projects. This is only done during the NOFO time. Typically, when the NOFO is released, and typically about a month prior, I reach out to all of you to see if you want to renew your projects or if you want to voluntarily reallocate all of your funding, part of your funding, any of those things. And it is not, some people have asked me about reallocating projects voluntarily. If your project is not working for your agency, if it was not designed correctly initially when it began 20 years ago, you can voluntarily reallocate that funding and you can apply for a new project. It's nothing against the agency, but we look for your agencies to review your projects to make sure that if this isn't working, what can we do to work together to make it work, come up with those solutions so that our projects are high performing within the balance estate. So when we do the performance monitoring, which will be coming out soon, there may be, and I hate to talk about this part, but there may be recommendations for involuntarily reallocation. The Balance Estate Executive Committee reviews and approves all reallocation decisions. It could be due to a history of like inadequate financial management, monitoring findings that we haven't received responses on, not managing your grant properly, other capacity issues at your agency. But again, this happens during the NOFO process. It is a possibility if your project has been performing poorly during the last couple of years and continues to have an annual performance monitoring report, your project may be recommended for involuntary reallocation. Again, the executive committee reviews all of those recommendations, and I can tell you, since I've been here, the Balance Estate has not involuntarily reallocated any of its projects. We have been able to work closely hand in hand with projects to adjust their budgets, do grant amendments, provide technical support or assistance so that they can improve their performance and serve the people of New Hampshire effectively. I'm going to pause there because people typically have questions about reallocation. It's a hot topic. You guys are all very quiet today. So we've talked about this before. Again, we use that performance monitoring to look at how your project is performing. And if we see that it's underperforming, either during performance monitoring or during NOFO rank and review scoring, that information is presented to the Continuum of Care's Executive Committee to have those conversations. We look at the projects that have the lowest score in the evaluation project. We also really look at projects that have unspent funds in the most recent fiscal year ending, which is the federal fiscal year. And what I can tell you, recently HUD has begun to reach out to the Bureau of Homeless Services about low spending projects. I know I've reached out to a couple of your agencies for explanations. HUD is actively reviewing all of our projects to see that we're spending our funding down and utilizing it appropriately. And if not, what solutions can we come up with to expend the money of your grants? Or do we need to voluntarily reallocate some of that funding during NOFO so that it can be used for other projects? Does anyone have any other questions? I know I ran through that really, really fast because I'm a fast talker. Not seeing anything in the chat. So if you do have any questions, I will be sending this PowerPoint out to all of you. And again, the Balance Estate will be issuing those performance monitorings, hopefully within the next couple of weeks, so that you all can see them. With performance monitoring, the Balance Estate voted a couple years ago, we do a median average of all of the project's score, and we only issue reports to those people who fall below the median. And that information is shared with the Continuum of Care, what each project's scores were. We issue those reports. They're sent out to the agencies And then the responses are reviewed by the executive committee to make sure they're acceptable. They're all very quiet this morning. The only other big thing that I want to put out there is that for all of you COC projects, I will be sending out an email. I typically do this at the beginning of the year, but I don't know what happened to this year already. We will be sending out requests for scheduling your annual recipient monitoring, where we come out and look at participant files and financial information, including we are working on SSO reviews as well. So if you have a coordinated entry project, we are starting to annually monitor those as well. We are working with the Technical Assistance Collaborative to beef up our supportive services only project policy and procedure manual, so that you have more guidance on how these projects should be operating and what requirements they need to meet per HUD. So some big things coming up in the next couple of months. And the Housing First training series, which I'm very, very excited about. All right. I'm hoping to have another meeting in May or June-ish, but May is usually easier because June's always end of school time. And I will get that agenda out to all of you as soon as possible. We will be really focusing on what HUD highlighted in last year's NOFO, including connections to employment, which we talked a lot about today, and also equity. And leveraging healthcare and housing services for these projects. If you have any questions afterwards, please feel free to shoot me an email, and I'll respond as soon as I am able to. And I will share this information with all of you via PowerPoint. And as soon as I have a link to the video page, I will send that as well. Thank you all. I hope to see all of you soon. You're welcome.
Thank you, Christy.
Take care.
Bye.
Thanks, Christy. Bye.